Hello, this is Scott Yaris again with another in our series of videos for helping parents of school-age children who stutter. Now that you may find your child and yourself at home more, one of the things you probably want to be able to do is keep up on your child's speech therapy to help him continue to make progress, or at the very least to reduce the likelihood of a reduction in his progress and increase in stuttering. Many parents have called or emailed and expressed to me that they're not sure how to do that because you're not speech language pathologists and you don't need to be. In this video, what I want to highlight are a few of the key facts that I want you to know about stuttering. Even though you don't need to replace your child's stuttering therapist, you can help by learning some important facts. The first most important fact that you can learn about stuttering, we often say as stuttering is more than just stuttering. Here's what we mean by that. We mean that the experience of stuttering as your child is living it involves more than just the production of speech disfluencies in his mouth. Stuttering involves fear about communication, embarrassment about the moment of stuttering, anxiety about talking. It involves worrying about the reactions of others, especially others who may be focused on their fluency more than on what they're trying to communicate. And I talked about that in an earlier video. Stuttering also involves difficulty with day-to-day communication. Now, you may know all of this, but one of the things you may not know is that in good, comprehensive therapy for school-age stuttering, we work specifically on those things. It's part of the job of a speech-language pathologist to address not only the speech behavior, but also the impact of stuttering on your child's life. Well, you may not need to be a speech therapist, but boy, is this an area in which you can make a huge difference for your child. By recognizing the broader nature of stuttering, by understanding the entire experience. That helps your child when you understand that, because that means that you can talk to him about the difficulties that he's facing, not just the difficulties in speech fluency, but also difficulties in, for example, getting on the phone to talk to his friends or using FaceTime or Skype or Zoom, which is the way we're all supposed to be communicating right now. It may be very difficult for kids to do that because of the fear that they feel. Instead of telling them, well, just use your techniques so that you'll be more fluent, perhaps consider helping the child understand his fears. You can help your child understand that sometimes when we're worried about something, we think worried thoughts. It's not surprising that we think worried thoughts. But the more we think worried thoughts, the more nervous we feel inside. As we learn to look at those thoughts and to acknowledge that worried thoughts are just thoughts, and that it's not necessarily what's going to happen, the thing that we're worried about, that can help to diminish those worried feelings that we have inside. We diminish those worried feelings and we can then feel more confident to go out and do the things that we want to do, whether that be calling a friend on FaceTime and talking, or whether that be preparing to give presentations online in our new virtual classrooms. All of these are aspects of stuttering, and the more that you as a parent can recognize the broad nature of stuttering, the more you can help in these areas that go well beyond a focus on speech fluency. I'm going to give you lots more ideas about this. My colleague Nina Reeves is going to give you lots more ideas about this. You can always find info on our website, www.stutteringtherapyresources.com.